Сүрен қосып қоясың. Hello dear colleagues. Hello. Қорқпай жата беріңіз, жақсы ма? Аневризмаңыз көрініп тұр? Аневризма көрініп тұр, қазір жабамыз, жақсы ма? Қорқпай жата беріңіз. Ана аузындағы нені салфетканы түсіресірші. Аузындағы салфетканы төмен түсіресірші. Good morning, patient, 40 years old, young lady with unruptured incidental aneurysm, with headaches, and on MR and CT angiography it was nearly 5 millimeter aneurysm. Yeah, sure. And Roman Maratlo made a 3D angiography, and you can see the aneurysm. Just a second, we can discuss. Пока суға салып қой бер. Okay. This is 3D angiography. As communicating segment is also this plastic. This is nearly 5 millimeter aneurysm. Okay, let's see. It's very important to check the NPR when we discuss the communicating segment, but it's look like aneurysm. It's look like there are two aneurysms, one bigger, one smaller. There are two aneurysms. Okay. The simply way to treat this both aneurysm is to place the flow diverter. But there is a diameter difference. That's why we decided to do balloon assist coiling. Okay, let's see. What we can do. The only issue, we have no regular stents, but it might be infundibulum also. Something like this. 111.23. The picom segment aneurysm is nearly 3 millimeter. Okay, we prepared the instruments, but I think the better way to place the flow diverter. Які він досажда. Or we should give a general anesthesia. Let's think. Okay, just a second. Пока проверю. Okay, let's think about the possible options. For the one aneurysm, it was a little bit simpler, but the situation is there are two aneurysms. Huh? Okay. There is something behind, huh? There is something behind, okay. There is a PCOMS on both sides. I think it's an infundibulum, huh? It's not like infundibulum, okay. Let's start coiling. If it's need to treat the second one, then we can decide later on. 90 градусқа проверь. Так, оборва, да? Okay. Yes, it's an incidental finding. That lady is young and has a headaches. This is for coil, this is for burning. Yes, today is Monday. I attended, me and my colleagues attended WFNS, World Federation Neurosurgical Society courses in Astana. I did moderation on the sessions, and also I had two presentations on brain AVM and intracranial stenosis. Yes, it was very nice to see the friends from Istanbul, from Ankara. Erhan Turkoglu visited. He was a faculty member, and other colleagues, Mehmet Zileli and Onur Yaman, presented spinal session, and Shubin and other colleagues from China was also in Astana. And now in the morning I arrived to Almaty, and it's a 5 French, huh? It's a 5 French. Biz 5 French ашып тастадық, да? Иә. Introducer. Okay, we need to change because the guiding catheter is 5. Тируман бере сал. Destination mirror. Okay, now we're short from material. That's why we need to adapt our techniques from the regular way to modified way. It's all the time at the end of the year and at the beginning of the year. But this year, end of the year is happened in September. Huh? Usually it came later. Okay, let's do our best. Okay, it's much non-versal. Okay. Ана босс бар. Okay, let's take this one. Yes, fortunately the introducer sheath in this case Rowan took a 8 French, which is very important, and I will ask Rowan to put the diagnostic wire inside. It's better to Peter can da kaptet expresso. Peter can da kaptet expresso. As because of destination, we prefer to place 5 French inside. Так, проводник aldı. There is a problem, huh? For the 7 French we need a... It's a problem. We need a 9 French introducer sheath. Okay, we couldn't work like this. Just a second. Yes, it might happen. Just a second, I will take a 6 French guiding. This will take here. Так, шкафта açtım. Размножам. Между benchmark 95 бар, осы наш. Okay, we'll take benchmark, which is quite soft. Let's try to do with benchmark. Benchmark is like a envoy DA. Yeah? It was a guiding catheter. Rowan is quite younger. He didn't see the envoy DA. Envoy DA was like a benchmark. The distal part was very soft and atraumatic. Okay. Okay. Проводник алды. Кетті ма? Проводник алды. Okay. There is a focus defect, there is everything with the small problems. As comparing with the coronary devices, it's very soft. Huh? We succeeded. Okay. Now we can go a little bit deeper. It's a benchmark, it's quite soft. Ready? Okay. Рабочий проект соусный, да? 111'ді 23 кірген, да? We have this problem, no? Just a second. Okay, let's do it in working projection. Right 111 and cranial 23. Yes, and patient under local anesthesia. Oh, 111 was left side. 111 was left side. Which is caudal and cranial. 111 is 21, no? 69, right? 16. And caudal 23. It's like a mirror, no? Ayna сияқты. It's like a mirror. And it was look like patient has a very, not very, but has a collateral. ACOM is in place. There's a washout. Yes, it's a PICOM, fetal PICOM. It's in fundibulum. Stop. Okay. Yes, now we are inside the aneurysm, as usual for this segment. It's a lower branch here. Okay, now we're in exact position. As for the PICOM segment, it's just normal infundibulum, and we don't need to touch, which is назад чуть-чуть, which is better option. Так, вперед. Правильно. Сейчас. Алдыға итере сал. Так, ненің 4/10 ашасаш, оптиманың. The access now is 8 French introducer cheese, regular one, and the 8 French cheese we took which is benchmark catheter. Balloon for assistance is Eclipse single lumen with the hybrid wire which comes in the box, and headway 17, 90-degree angulated inside the aneurysm now. Which is for coiling. And the first coil we took a 4x12 microplex Cosmos. And second coil we asked to open Optima. Ne oldu? Şimdi sen kaz koyalım. It's the first coil. It's very important. Balloon assistance. Отдели. Микроплекс. Если это детачит. Үште төрт аша бер. Сізге емес, сіз қозғалмай жата беріңіз. Ау! Темір салып жатырмыз, қорықпаңыз. Қимылдамай жата тұрыңыз қазір. Бәрі ойдағыдай жүріп жатыр. Отдели. Detach. The second coil was 4x10 complex Optima. Now look like the headway is at the neck part of the aneurysm. Okay, let's see. On AP it's not so informative. On lateral it's look like the catheter is at the orifice. Just a second. A bit more like this. More office. Отдели. Так, Екіде қандай спираль бар? Екіде 4 ашайш. The next coil is 2x4 optimal. Кондиционер сосын неге қоя саласың ғой? 22-ке қоя бер. Өйткені қазір күн салқын ғой. Кондиционер 22-ке қоя сал. Отделе. Тағы да осындай ашып бере сал. Екіде 4 ашып берер. Или 2-де 8 бересің ба? 2-де 8 бересің. The coil number 4 was 2x4 and now coil number 5 is 2x8. Okay, let's see. All right. Ne oldu? It's a little bit bigger. Gaz, бітіреміз. I think it's enough, huh? It looks like it's enough. Okay. Қолын қысып жатыр ма? Мұрын жағын. Қазір бітіреміз. Okay. Let's check. Жарить, қазір бітіреміз қазір. Yes, everything looks stable. On AP we can see the whole artery. Okay. Қазір құдай қаласа бітіреміз. Я қазір басылады қазір. Сәл шыдай тұрмыз. Let's take out some blood. Which we call hijama. It's a blood evacuation technique from the vessel. Қимылдама, бәрі жақсы. Қимылдама. Қозғалма. So everything is clear. Aneurysm is occluded and from PCOM segment there is an infundibulum. Huh? Now we can see clearly it's an infundibulum. It might be half millimeter remaining neck, but I don't want to place stent here. I think it's not necessary. Seems okay. Stop. Yes, there is a picon. Ophthalmic artery is in place. The brain is clear, huh? Okay, let's take it out. And now Rowan will do XPER-CT. Так, бүгінге қанша пациент тұр?
Екеуі де түсті акцидент кейінгі. Қазір средний мозговой дайында жатыр. Ол вроде дайында.
Стент жоқ қой. Okay, we have another 2 patients, but the problem is we have no stents. On ертеңге. We have 1 patient for today scheduled. Okay, let's see. In 30 minutes it will be under general anesthesia. 30 to 40 minutes. Okay, let's wait for the XPER-CT. Бәрі жақсы ойдағыдай, қорқпай жатыңыз. Қазір бітірер болады. 5 минут бар. Уайымдамаңыз, бәрі ойдағыдай. Okay, dear colleagues, XPER-CT is ready. The brain is clear. Nothing else except artifacts from the coils. And now we can finish this case. See you in 30 minutes. Thank you for watching.